Hello, everybody, and welcome to this conversation that we are having with Care to Communities. I have a guest with me. I have Racha Yehia, who is the Acting Country Director of Care to Communities, and she is joining us from Haiti. Hello, welcome, Racha.
Oh, thank you, Rina.
I believe you have a PowerPoint presentation for us, so why don't we get started?
Okay, perfect. So, Care to Community, which short for C2C, started working in Haiti in 2010 after the terrible earthquake that the country suffered in Port-au-Prince area. But right now, we focus on the northern department. So I'm currently right now in the area of Labadie that some of you might know from the Royal Caribbean cruise line that comes to the country. So I would be around this area, and our clinics are around the northern department. We have 7 operational clinics, mostly in rural areas and one in peri-urban area. When it comes to the history of how we started those clinics, as I said, it started with the earthquake, and then we brought in containers, and then that's how we started providing high quality primary health care in the country. And then afterwards, we said, "Oh, it's not the most sustainable thing to bring a container from the States. Let's take a house and turn it into a clinic, or a building to turn it into a clinic." So that's what we did with our third clinic. And we turned a house into a clinic. But then we said to ourselves, why are we creating something new? Why are we building something new? Why don't we take something that's already there, that is not working properly, and give it another life? So we decided to do a partnership with the community, with the Ministry of Health. So we have a PPP, which is a private public partnership with the government. So we've taken some of their clinics that are underdeveloped and given them another life. So we have the one-stop shop model, which is people will come and pay a certain fee to see a physician. Then afterwards, they will do their lab tests, and they will get their meds all in the same place. Why do I mention that? Is because here in the health sector in Haiti, you'll go see the doctor, and then you will get labs prescribed, and you have to go somewhere else, and then you have to go get your meds in all different clinic pharmacies to ensure that you have everything, which is sometimes a long process for someone that is sick. So we try to reduce this whole inefficiency and have everything in one place. And that's how you have reliable, affordable, and sustainable service provided to the communities that we serve. But on top of that, we don't only have so this is how you see, this is one of the MSPP, the Ministry of Health clinic, that we completely renovated. We've put a fence all around, and we fixed up the roof. And so far, this clinic, before when we came in, had 30 medication on the shelf, now has more than 100 medication, has electricity. So it has electronic medical records, which didn't have that before us coming in. On top of providing clinical service, we also have specialty programs as community health program, where we provide vaccination, we provide family planning, we have malnutrition program. We also do home visits to patients that can't come to the clinics. And we also do educational classes in remote areas. And also we have the maternal health program. And C2C has been always very committed in providing um, care to women, and specifically, we wanted to go even further and see how we can have educate women on having more control over their reproductive health. And this is why, with the help of Dining with Women, we are able to start, as of January 2021, after school sexual and reproductive health program. And this program will have a variety of topics that we're going to discuss with the girls, addressing myths, addressing beliefs, and this way it will prevent early unwanted pregnancies, reduce sexual transmitted diseases, also empowering them when it comes to their bodies and their relationships. But unfortunately, well, not for, but which is great about us is that we can't do anything without the help of the community. And that's why before starting a program like that, we have to do a feasibility report. And that's why we've interviewed political leaders, religious figures, principals, teachers, parents of teenage girls, and health practitioners. And we've asked them, what do you think about us having a program like that in our communities? Do you think the community will benefit from such a program? And all of them were very receptive to the idea, and everyone was like, when can you start? So this is very encouraging because it's been in a long process. We've been brainstorming how we can tailor this project, and we're very happy that we can go on and start as soon as next year. But eventually, there's always, for us, it's a long-term goal. And with the help of Dining for Women, we're able to start with the stage one, which is giving classes to girls after school, for around 20 girls or so, uh, from 13 to 18 years old. And after that, the second stage would be in 2020 to 2022, where we can have a class for boys and a class for girls, because as you know, it takes two to tango. So this would be the stage two part. And then the stage three part is then when the community started getting comfortable with us, when the people know about our program, then we can divide it into age groups, because puberty starts at a very young age, which around 10 years old. So we want to educate the communities, but we don't want to we want them to get comfortable with us. So we would have two groups, 10 to 14 years old, and then 15 to 18 years old, of boys and girls, always divided. So it's just easier to handle the classes. Then stage four would be a partnership with a private school, where we can also teach the curriculum there and see how it is at a bigger level. And then eventually, after 4 years of our pilot project, our long-term goal would be to present this to the Ministry of Health and the Ministry of Education, and to have this kind of program, sexual education program, and all the at a national level in all the high schools around the country. So that would be the long-term goal, but we're very happy and very fortunate to start with stage one with Dining for Women.
Oh, that's absolutely wonderful. We are thrilled to be part of this cultural transformation that you're trying to create, not only in Cap Haitian, but also in the entire country. So, give us some kind of history of Haiti and some of the challenges you're going to be facing in trying to create this cultural transformation.
So Haiti is a special kind of country because it is, as everyone says, it is the poorest country in the Western Hemisphere. And I think partly why Haiti has become, or Haiti is the poorest country, is because we were colonized by the French. And then after reaching independence and abolishing slavery, we had to pay France a fee to let for us to get our freedom back. So I think by that, well, I don't think, I know that the government had to pay a big amount, and that is how our government has not been able to help the communities as much as they would want. And that's why national aid, international aid has come from all over the world. And one of the biggest aid that we have in the country is USAID, where we have a lot of projects going around on a national level, but a lot of the projects focus on agriculture, focus on reforestation, focus on environment, but not many projects focus on health or education. One of the biggest projects currently is HIV and AIDS, but that doesn't tailor much to the education factor that we want to work with. So I think this is an important project, and I think Haiti, in a way, has suffered many natural disasters and has gone through many heartaches. But in the long run, I think a project like that would help a lot the communities we are working in.
Absolutely. So, at Dining for Women, we are beginning to have a greater understanding of the role that we can play. I mean, not only do we have our members and donors donating to the project that will fund your project, but we also have members who have taken keen interest in advocacy, and they are lobbying their senators and congress people for that USAID funding that in some ways may be trickling down to all of you. So we understand there are these multiple ways, and there are many ways to make cultural transformation, small amounts and big amounts of money. Moving on to us having a greater understanding of your community in particular, the girls that our funding is going to address. Who are these girls? It is interesting culture, multilingual, French and Creole. And who are these girls? Tell us more about them.
So the girls, what's interesting about this project is that it's tailored to all the girls. So girls that have dropped out of school, girls that are still in school, but it's specifically for girls that have not had a child first, have never had a child. And we want to reach them before they start coming for their first prenatal visits. So we want to reach them a little beforehand. And it's tailored. So there's this conception here in Haiti that when you start um, when you're in school and then you get pregnant, then automatically you don't go back to school. So then let's say you're 14 years old, you're faced with having one child, and you have to able to survive and secure financial stability for your child, and then it doesn't come with marriage. There's a curiosity, and it starts at a young age, because these kids, they you can have 10 people living in one room, and let's say you assume that your parents are sleeping, but then they're having sex right next to you. So this first starts enticing you and starts enticing your curiosity. And then most of the time you don't have electricity in the country, so people don't have TV, don't have internet, so you're just talking with your friends and you're socializing. And this is where sexuality becomes one of the topics of these young kids around 10, 11, 12, 13 years of age. And then you become curious and you start having sexual intercourse, and then if you don't use protection, then you get pregnant, and then that's when you start having your first child around 15, 16 years old. But you haven't gotten married at that age, you haven't finished your high school at that age. So this way it starts that vicious cycle of poverty, and then you want to help secure this stability for your child. So then you are with this boy that's also at a young age like you, and then he leaves you, and then you're left alone, and then you work as a in a marché, or you work selling little goods here and there to able to get $1 or $2 a day for your child, to survive and put food on the table. But then you start looking for another man that can also help you sustain this life. So at the end, when we can see from our malnutrition program, some of these women have 3, 4 kids from different men, because at the end, you're just trying to get someone to help feed your child and help put food on the table, and provide security. And a lot of the times, these women, they have this man which they're not married to, and then that man is going to go somewhere else to another city to go work, so then they're left alone, and they have all that stress again. And that also not helps, but also goes into the cycle of trying to find another man that can help them survive.
Mhm.
And um, and we want to decrease that. We want to educate them, we want to empower them, we want to provide them um, with this education, that you know what your rights are, you know what your your human rights are, you know what your body, your human body, your puberty, and these are all things that are not brought up at home, they're not brought up at school. So we want to focus on empowering them and giving them that education they deserve.
Absolutely. We don't think of this that much, but the presence of electricity And I know we're trivializing it in a sense about TV and stuff, but those are gateways into opportunities because it's opening out another world to the young girls and say, okay, maybe if I have an education, I can do this like I saw on TV.
Hmm.
Maybe I can do that. And without all of them, without all of those resources, they're kind of living this tiny little life and trying to make the best of what they can. Um, we take all of that so much for granted, the rest of us.
Definitely,
It's
definitely.
absolutely wonderful that your organization is trying to reach these girls early, trying to present those options to them and say, maybe this is how you can secure your economic future, your health,
Hmm.
protection against STIs and long term health, because most young people don't see beyond early adulthood. So that
Definitely.
is absolutely wonderful and extremely noble that you're even trying to spread the project all around the country. So, given the cultural history of Haiti, given the extreme poverty of the country and sometimes poverty even of the people, um, you're working with all of this. We have done projects in Haiti before, and we have heard this time and time again that marriage sometimes is a luxury for the rich, and the poor often feel like that is not an option for them. So, as we wrap up, what else can you tell us about this cultural context you're working in and where you hope to see these girls in another 5 years?
As you mentioned, it is true because the ultimate goal of a person or success is to be able to get married, able to provide for their family, able to build a home, able to put their kids in school, and that is not always the case. And because when you get pregnant at such a young age, it kind of, I don't want to say, but it stops those dreams from coming true, especially for girls. So by starting these classes and by educating girls by specialists or people that have been trained to give this curriculum, no, so like it would be a nurse, it would be a social worker, and tackling these questions that these girls have, because it's all about curiosity. But educating them and giving them the proper education, not like these myths that they have all around, and which all countries have, and specifically Haiti has a lot of myths around sexuality. But giving them this opportunity of getting that proper education and then saying, knowing their rights, knowing when to say no, knowing uh, how to go about when someone is trying to pressure you towards having sex with them. And I just want to build that confidence. And when you have that confidence, and then you know what you're doing, and you know what you want, and you know more about your body, then you're able to stay in school for longer, you're able to get that high school degree, and you're able to reach your goals, and not change your goals around because you
Mhm.
got pregnant at 13.
Absolutely. Rasha, it has been such a delight speaking with you. Some of the issues that you are dealing with in Haiti is the exact same thing we deal with in the United States. I work with college students. I know what it's like to have those conversations, how to say no. So, empowering young girls and giving them a future they deserve is a worthy goal. So, good luck. We wish
Thank
you the
you.
very best on your project. Thank you so
Thank you for
much.
helping us. Thank you.
You're welcome.